I'm Terrie Cowley with the TMJ Association. On behalf of all of us, I want to thank the Facial Pain Association for your invitation to tell you about TMJ. We compliment you on all that you are doing to bring awareness to improve the lives of those affected by facial pain. We certainly feel a kindred relationship to you, which was begun in the 1990s when your founder, Claire Patterson, and I would commiserate together at NIH meetings. But it's even more than that. A 2021 article shows the large numbers of misdiagnosis of TN for TMJ and vice versa, showing we both have so much more to do to advance our respective science areas. Sandy Guilfoyle and I met through a short article Sandra submitted to the Milwaukee Journal about TMJ in 1986. Upon meeting, we immediately noted the need to find out as much as possible about this condition, and we organized a local support group. Began exploring the TMJ literature to learn that there was no basic or clinical science underlying the treatments we had that resulted in harm. And we quickly heard from others that suffered similar outcomes. We incorporated the TMJ Association as a 501c3 in 1989. One of the treatments popular in the 80s was implanting Silastic or Proplast Teflon between the skull and the condyle. In 1991, the FDA issued a Class 1 recall on the Proplast Teflon material because of what they termed, quote, open communication to the brain, unquote, which simply means the material worked its way through the skulls into the brains of the patient. Our advocacy efforts resulted in a congressional hearing entitled "Are FDA and NIH Ignoring the Danger of TMJ Implants?" As you see, our advocacy work also attracted the Wall Street Journal reporter Bruce Ingersoll, who wrote this article. And at that time, it was the longest article, front page article published in the Times, in the journal. These experiences explain our passion to make the TMJ Association's primary goal to advocate for the best darn science this country has, and that it be directed toward TMJ. Our other goals are to serve as the resource center for the most comprehensive, credible information on TMJ, to promote awareness of the reality of what TMJ is like to experience, to provide support to patients, their loved ones through Inspire, an online platform, and by linking patients to each other and receive empathetic support. We are proud of a number of accomplishments we've achieved over the years. We organized 8 scientific meetings, which were co-sponsored with the NIH. We have 22 years of consecutive congressional appropriations report language, directing the NIH to increase funding and quality of research toward TMJ, classifying TMJ devices at the FDA, attaining a GAO investigation on how TMJ devices got approved at the FDA, and many others. You can find a list of our achievements and much other information on our recently revised website, www.tmj.org. Two of our recent and very important projects are the TMJ Patient-Led Roundtable, which began in 2016 and will be ongoing. It is the first of its kind, public-private collaboration under the auspices of MD EpiNet and with backing of the FDA and involving many TMJ stakeholders from the US and internationally. We started the roundtable with the need to find out why some TMJ patients improve with implant surgery while others worsen. It evolved into a far more comprehensive study of all aspects of TMJ and how they interact to affect patient outcomes. The goal is to establish a scientifically valid roadmap that can reliably predict treatment outcomes for individual patients. Currently, we are working on developing elements for the first TMJ patient registry. The other, through our efforts working with Congress and NIH, is the very first ever study on TMJ disorders. This was conducted by the National Academy of Medicine. The study covered comprehensively everything across all of TMJ, all the areas as were the recommendations which came forth from the study. The report accurately reflects the dismal state of TMJ and provides 11 recommendations which, if implemented, would incredibly improve this field. I will now turn you over to Chris Veasley, who is going to introduce herself, introduce the CPRA, which is an initiative of the TMJA, and also give you a primer of TMJ. Chris, take it away.
Thanks very much, Terrie, for the introduction. My name is Chris Veasley. As you mentioned, I'm the co-founder and director of the Chronic Pain Research Alliance, which is an initiative of the TMJ Association. Terrie and I founded the CPRA back in 2009 as an initiative underneath the auspices of the TMJ Association when research became very clear that it actually is very common, particularly in women with temporomandibular disorders, to develop other pain and non-pain conditions. And so the CPRA was established really to have a special emphasis on understanding why some people go on to have multiple overlapping, what we'd call medical conditions that are either pain or non-pain conditions, and to really advance education for clinicians and patients, as well as better therapies for people who have these. And we're going to get into this a little bit more in the presentation. But first, I'm just going to give you a little introduction to what the TMJ is and what temporomandibular disorders are. So what is the TMJ? Simply put, the TMJ stands for a temporomandibular joint, right? It's the jaw joint, and we have two of them, one on your right and one on your left. And many people don't know this, but the TMJ is actually the most complex and most used joint in the body. When we think about joints, we think about the shoulder, the knee, the hip, the elbow, but a lot of times we don't think about the TMJ as an actual joint. And it is highly complex and very used in almost every activity throughout the day. However, one of the reasons why we are where we are in terms of lacking a lot of clear answers for people with temporomandibular disorders is because it is the least studied joints in the body. So how does the TMJ work? We know kind of how our knee works, right? It goes in one direction, forward and backward, but the TMJ actually moves in 3 different directions. So you can see in this video, it allows you to move your mandible or your chin area forward and backwards. It allows you to open and close your mouth, and then it also allows you to move your mandible from the right to the left or side to side. So you can tell how complex it is just by looking at the different movements that the TMJ does. So what are temporomandibular disorders then? So like you can have an issue with any one of the other joints in your body, your knee, your hip, you can have issues in the jaw joint and in the surrounding tissues. But what research has actually shown us is that for a lot of people that have a temporomandibular disorder, it's not just a problem of the joint, right? So TMDs are defined as a complex, under-researched, and poorly understood set of conditions, and they're characterized by having pain in and around the jaw joint and the surrounding tissues, which can be the muscle, the ligaments and tendons that all surround your jaw joint. And oftentimes, but not always, it's involved limitation in your jaw movement. So either opening or closing your jaw, moving it to the left or right, or any of the functions that your jaw does. And recent studies have shown us that TMD is actually a very complex condition that can involve multiple body systems. So it can involve your circulatory system, disorders of your digestive system, your endocrine and exocrine systems, the immune system, musculoskeletal, reproductive, so on and so forth. And that TMDs are no longer considered a condition that's just confined to the teeth and the jaws. It's not a dental disorder. So very briefly, TMDs are classified into kind of 3 large categories. So on the left, you can see that we have disorders of the joint, and that would include like joint pain, disorders of the disc, that is in between the bone in your jaw joint. And then you can also have degenerative joint disease or bone destruction in your joint. So those are some examples of disorders of the actual joint where you have breakdown or dysfunction or damage in the joint itself. In the middle section, you can see that you can also have disorders of the muscles that are used for chewing. And these are also called masticatory muscles, right? So some examples there are pain that would be located in one area that gets worse when things such as applying pressure, and that's all called myalgia. Or pain that spreads beyond the point where it starts, or pain felt in an area of the body far away from where it started. So you can have myofascial pain with or without referral. So that basically means that you can have pain in the muscles around the jaw joint, and then you can have pain in the muscle or myofascial pain anywhere else within your body. Could be in your head, but it could also be elsewhere. And then this third very broad category is headaches that are associated with TMDs. So that's any type of headache that a person can experience along with a painful temporomandibular disorder. And just to note that you can have one or more of these conditions at the same time. So what do we know about prevalence of temporomandibular disorders? First, I'll just say that we need much more research in order to understand the national prevalence of TMDs. And part of this is because there's so many conditions that kind of fall under the broad umbrella of what a temporomandibular disorders are. But a recent study that was cited by the National Academy of Medicine report that came out in 2020 found that between 11 and 12 million adults in the United States had pain in the region of the temporomandibular joint. We do know that TMDs are twice as common in women than in men, particularly in women in their childbearing years. So you can see this is just very general, basic information, and that we really need a lot more epidemiology research to understand the prevalence and risk factors of TMD. Now, what are some causes of TMDs? So adding to the complexity is that there can be multiple causes. And there's also cases where a person has pain in the region of the temporomandibular joint or the surrounding tissue, and no obvious cause can be found. Just like some people start developing headaches or back pain, and there's not really any one thing within the joint or the muscle or the skin or any of the nerves or tissue that you can actually point to that's an obvious cause for the pain. But we do know that some things can be associated with the development of a TMD, such as autoimmune diseases. Those are conditions where your body's immune cells attack healthy tissue. You can have injuries in the jaw area, dental procedures, insertion of a breathing tube before surgery, and various forms of arthritis. And these are just a few examples. Additionally, research has really shown us recently that TMDs, that there are genetic, hormonal, and environmental factors that kind of interplay that can increase your risk of developing a TMD. And that, this line of research is actually leading to the discovery of new ways to treat TMDs. So that's quite promising. And the observation that jaw problems are commonly found in women in their childbearing years has also led to a lot of research to understand the role of female sex hormones, particularly estrogens, in TMDs. So what are some symptoms? As with many other painful conditions, the symptoms can really range from mild to very severe, right? You could just, on the mild side, have some abnormal joint sounds like clicking and popping when you move your jaw joint. Other people are on the other end of the spectrum where they have severe debilitating pain and joint dysfunction, sometimes to the point where their joint is not functionable at all. Extreme examples are where people maybe have to eat through a straw. And so it can be quite severe and quite painful. And some people report absolutely no pain, but they may have jaw dysfunction. And some people may report pain and not have any jaw dysfunction, right? So it's very individual to the person with a TMD. But some symptoms that may signal a TMD include pain in the chewing muscles. We just talked about those that are called the masticatory muscles, and or the TMJ, which is the most common symptom. You can have pain that spreads to the face or the neck, jaw stiffness, limited movement or locking of the jaw, painful clicking, popping, or grating in the jaw joint when you open or close your mouth. Some people have ringing in their ears, hearing loss, or dizziness, and also may feel a change in the way that the upper and lower teeth fit together. So importantly to note around diagnosis is that there is no widely accepted standardized test available to diagnose a TMD. And because the exact causes and symptoms aren't clear, identifying TMDs can really be difficult for practitioners. But when you're undergoing a diagnosis to find out whether or not you do have a TMD, your doctor or your dentist may note your symptoms and take a detailed medical history. They should ask questions about your pain, including where it is, when it occurs, what makes it better or worse, and if it stays in one area or spreads to other parts of your body. They may ask if you have other pain conditions, such as headaches or back pain. They may do an examination of your neck, your face, your head and jaw for tenderness, jaw clicking or popping, or difficulty with movement. Sometimes they may suggest imaging studies such as an X-ray, an MRI, or a CT. And then you also would want to make sure we're ruling out other conditions that can mimic a TMD. So what are some of those conditions? Headaches are very common, right? There are a lot of different types of headaches, such as sinusitis, tension, migraine, or cluster headaches, bruxism, where you're grinding your teeth, or referred pain from neck disorders that can go into the area of the temporomandibular joint. Other types of pain, such as postherpetic neuralgia, complex regional pain syndrome, head and neck trauma, toothaches, trigeminal neuralgia, cardiac pain, salivary gland disorders, pain that accompanies hearing problems can be commonly mistaken for TMDs, or head, neck, or widespread body pain, such as fibromyalgia or myofascial pain. Some other symptoms include pain and numbness that may be felt from metastatic tumors, pain that radiates to the TMJ region, such as you'd have after whiplash or something where you have an injury that affects the muscle or cervical spine. Pain that worsens with swallowing or turning your head could come from cervical, spine, or muscle disorders, Eagle syndrome, subacute thyroiditis, and then also lockjaw, which could come from conditions such as infection or depressed fractures. So it's very important to make sure, obviously, that you're ruling out, when you're undergoing a diagnosis for a TMD, that you're ruling out other conditions that can kind of mimic the symptoms of TMD. So as I mentioned before, one of the reasons why we started the Chronic Pain Research Alliance, an initiative of the TMJ Association, is because research has brought to light the fact that it's very common for people with TMD to also suffer from other medical conditions, and that these were not just isolated incidents or conditions that appeared by chance. So it's very common for people with TMD to have other pain conditions like fibromyalgia, chronic headaches, back pain, pelvic pain, conditions like chronic fatigue syndrome, GI disorders, including irritable bowel syndrome, various forms of arthritis, autoimmune disorders, asthma, allergies, environmental sensitivities, connective tissue disorders, heart disease, sleep disorders, mood disorders, neurologic conditions, and this is just a partial list. So again, as we just talked about, it's important to make sure that your provider is ruling out other conditions that can mimic symptoms of TMD, but also understand that other chronic medical conditions can coexist with TMD. And research is actually looking at these different body systems or TMD from a multi-system illness perspective to understand why there is a connection between TMDs and these other conditions. So before you initiate treatment for a TMD, it's really important to know and understand that sounds in the temporomandibular joint, such as clicking and popping without pain, it can be very normal, and they happen frequently and may not need treatment. Also, signs and symptoms of TMD go away in many people without treatment or with very minor self-care. And because we have so little scientific evidence for the majority of the TMD treatments that are available, experts really strongly recommend staying away from treatments that cause permanent changes to your temporomandibular joints, your teeth or your bite, the way that your teeth fit together, or that involve surgery. So what's some self-care modalities for TMDs? Many, as we just discussed, many jaw, joint, and muscle problems are temporary and they don't necessarily get worse. And simple self-care measures may be all that's necessary to improve them. So when a person first feels discomfort in the jaw joint or the muscles, it's good to eat soft foods, to apply heat and cold to the face and the jaw in combination with gentle exercises that can stretch and strengthen the jaw muscles, to take over-the-counter medications like ibuprofen, and to reduce habits such as jaw clenching, gum chewing, and nail biting that can put stress or strain on the jaw joint. And this is a summary of TMD treatments. And as I just mentioned, we have very little scientific evidence that's really investigated the effectiveness of these treatments. So as you can see on this table, it's arranged very helpfully from the left to the right, from green type of simple treatments all the way to the right side in red, which are more complex treatments. So the green ones are simple treatments that should be tried first, like eating soft foods, applying hot and cold, the jaw stretching, NSAIDs, which are anti-inflammatories or self-management. In the yellow category, these could be prescribed by a doctor or dentist as a second step if the simpler treatments don't help. And those include like behavioral health approaches, physical therapy, prescription medications, intraoral appliances, and complementary treatments. The orange column, these treatments, experts say to proceed with caution if these treatments are recommended because they involve going into the jaw joint using needles or other instruments. So that includes prolotherapy, arthrocentesis, and arthroscopy. And then in red, the complex treatment, it basically is a surgery, which would be an implant for the temporomandibular joint. And experts really caution to consider these as a very last resort, and you should always get a second opinion. These involve direct access and permanent changes to the jaw joint. So, as you can tell from my presentation, it's limited information, and I've said this multiple times that there's little scientific evidence backing a lot of the treatments and what we understand about diagnosis and classification and all of that. So you may ask yourself the question, or maybe wondering, why is there so little definitively known about TMDs at this point in time? And it really stems back to the federal research investment in temporomandibular disorders. So you can see on the top in blue that this is the amount of dollars in millions, and it's rounded up to millions, that the National Institutes of Health has spent on TMD research. So you can see in 2013, it was a roughly $19 million that was spent all the way through and estimated for 2022, which is $20 million. And what that comes out to is about $1.45 per American adult with TMD. And that prevalence estimate that we used before is really thought to be a gross underestimate of the number of people who actually have a temporomandibular disorder. So as you can tell, this is not a lot of money that we're spending on research per person affected with this condition. And that led to the conclusion that you can see on the right side of the slide, conclusion 4.4 from the 2020 National Academy of Medicine report on TMD, where the committee said that the level and appropriation of funding for research on TMDs does not reflect the complexities of these disorders, their prevalence and impact, or the need for transdisciplinary research with a focus on clinical care impacts. So if we're investing such little money in TMD, something that's very complex, along with the fact that we have very little research on the jaw joint itself, including normal functioning of the jaw joint, as well as dysfunctional movements or activities of the jaw joint, in combination with the fact that we don't have a lot of research on TMD in general, it's no wonder as to why we don't know a lot about these conditions at this point in time, which is unfortunate because there are so many people that are very much suffering with these conditions. So what's the result of this poor investment of research? And these conclusions, again, came from the 2020 National Academy of Report on TMD, which I would encourage you to read. And the first is that researchers have yet to unravel the etiologies or the causes and the pathophysiologies or the disease mechanisms of TMDs, or to translate those findings in a meaningful way into improved clinical care practices for patients. So this is basically saying that we don't know a lot about what causes TMDs or what the disease mechanisms of them are. And therefore, we haven't translated a lot of that knowledge in a meaningful way to improving clinical care for people who suffer with TMDs. The second concluding result was that most general dentists and many specialists receive inadequate education and training in TMDs and orofacial pain, and this leads to inconsistent and sometimes harmful and unnecessary treatments provided to individuals with TMD. Third, data are inadequate and of poor quality for most treatments for TMDs, which basically leaves patients and clinicians, quite honestly, without any real information on which to base treatment recommendations. It's really a trial and error process of figuring out what might work for you, which is very frustrating for both clinicians and patients who are trying to improve care. They determined that research is needed to determine safe and effective treatments for TMDs, and systematic reviews and methodologically rigorous new studies are needed. And finally, there's often a lack of collaboration between clinicians, particularly dentists and physicians, and this divide can make it very challenging for patients with TMDs to get access and coordinate care. So TMD is a disorder, as we've learned, it's a disorder that can involve the jaw joint, but also other body systems and coexist with other medical conditions. However, it's oftentimes not treated in medicine. It's treated in dentistry. And so there really needs to be more of a lack, or there needs to be more collaboration between clinicians. There needs to be an adoption of TMD into medical disciplines, as well as collaboration between dentists and clinicians to treat patients with TMD. So what do we need moving forward to really help people who are suffering from this condition, to advance our knowledge on TMDs and to improve clinical care? This was a finding from the National Academy of Medicine report that says that action is urgently needed to improve care for people with TMD. It's too long been compartmentalized as a dental issue. Both the clinical management of and research addressing TMDs needs to implement a holistic and multidisciplinary approach, which just means we need a whole person approach, and we need multiple disciplines, different types of clinicians that are involved in the treatment of TMD, as well as different types of treatments themselves. Furthermore, the divide between medical and dental care is vast, and it profoundly affects the care systems, the payment mechanisms, and the professional education and training around TMD. So as Terrie began this talk and told you a lot about all the great work that the TMJ Association has done, we invite you to join us in this fight to improve care, to advance research. We invite you to visit our website for more information on TMDs, as well as what we do, and to join with us to exercise your voice and to advocate for improved research and care for people with TMD. Thank you very much for your time.